New graduate nurses often experience poor communication with coworkers and they tend to have a lack in confidence. Communication failure related to patient status at the time of nursing report handoff. New grad nurses often resign due to burnout related to poor communication with team members, healthcare providers, and patients, as well as a lack in confidence in their clinical skills. Why does the problem need to be addressed? Poor handoff communication is a leading contributor to medical errors and adverse events occurring during inpatient care and treatment. As a new graduate nurse, you will implement leadership by building a strong clinical foundation and seeking mentorship to develop confidence and leading at the bedside. When implementing a new team-based care model that focuses on appropriate patient handoff to prevent various communication errors, patient care errors, and establishes a new shift change model for team members to follow to enhance patient care. During the new graduate nurse residency program, implementation of simulated scenarios for new nurses to enhance communication skills with other new grad nurses, nurse leaders, physicians, pharmacy, and other members of the healthcare team. Following these simulations, a discussion of proper communication techniques, confidence in difficult clinical situations, and the needs of the new nurses would be held.
So this slide discusses the background. It talks about why the situation is like this and what the current practice is when nurses are giving and receiving report. SBAR seems to be the most common standardized tool used in hospitals. However, many nurses do not use exactly the SBAR method. Most of the time they use their own report sheets or use one they found online. Quality also depends. Quality during handoff also depends on how well that nurse understands the patient's care plan and how the patient needs to be taken care of. Another problem when nurses are receiving handoff and giving handoff is that, especially for new graduate nurses, they feel as though asking questions during report they often report anxiety. Most healthcare facilities recommend using the SBAR method as a standardized tool when giving report, but that is not always done. The need for change is identified because many new graduate nurses are leaving. There's a very high turnover rate. Oftentimes they feel like they're provided an unclear and incomplete report, which affects their course of the care plan. It is also reported that they were not given, new graduate nurses often feel like they weren't taught the proper way on how to give and receive report to get that vital information needed to take care of the patient for the shift.
On this slide, we have the assessment. The assessment of the situation reveals that communication failures during nursing shift reports are a significant concern within the clinical setting. New grad nurses often experience anxiety and lack of confidence, which can further hinder effective communication and the exchange of critical patient information during handoff. These challenges contribute to poor end-of-shift handoff, increasing the risk of medical errors and adverse patient events. Strengthening communication processes and providing support for new grad nurses are essential steps to enhance patient safety and promote a more cohesive and confident nursing team. Under that, we have variables that have contributed to this, and these include communication failures. So, ineffective handoff communication is a leading cause of medical errors and adverse events in the healthcare setting. Then we have new grad nurses, their challenges, and new grad nurses often experience anxiety and lack of confidence during handoff, leading to increased stress and potential errors. And lastly, we have burnout risk in new grad nurses. So, high burnout rates among new grad nurses are linked to poor communication, inadequate support, and unclear expectations. On the right hand side, we have the 3 parts of NSI broken down into categories. First, starting off with structural, these will include training programs and staffing support. Then we go to process, and so for standard handoff communication, we will implement the use of SBAR. to promote consistent accuracy and patient information exchange. And then for interdisciplinary collaboration, we will have debriefing sessions and regular feedbacks to identify gaps in healthcare and improve teamwork. And lastly, we go to the outcome. We have here to reduce medication and communication errors through consistent use of structured handoffs and teamwork, improve patient safety outcomes and satisfaction by minimizing preventable events such as falls, pressure injuries, and infection rates. And lastly, we have increased new grad nurse confidence and retention as they feel more supportive and competent in their roles. And lastly, I have some potential risk factors to patients, and this includes medical errors, adverse events, and patient harm.
For our recommendations, we will be implementing a standardized handoff communication tool such as SBAR or iPass. This is going to ensure that essential patient information is consistently communicated between shifts. The evidence of this is that the Joint Commission identifies communication failures as the leading cause of adverse events, and studies show that using structured handoff tools decrease preventable adverse events by 23%. We will also enhance interprofessional communication by training through simulation. We'll integrate simulation-based communication training into nurse residency programs to allow new graduate nurses to practice handoffs, conflict resolution, collaborative communication with multidisciplinary teams in a safe environment. This simulation training will improve communication skills, teamwork, and confidence in new nurses. We'll also establish a mentorship and peer support system by pairing new grad nurses with experienced nurses or preceptors to provide real-time feedback during handoffs and foster a psychological safety. Mentorship programs have been shown to reduce new grad nurse turnover rates and increase confidence in job satisfaction. We will also conduct regular debriefing and feedback sessions. Following each shift or simulation exercise, we'll hold a brief, structured debriefing to discuss communication challenges and identify strategies for improvement. Reflective debriefing promotes critical thinking and self-efficacy among nurses. Within all of this will improve communication during nurse handoff and also reduce new grad nurse burnout. For our process of carrying out our recommendations, we are going to start with a planning phase in which we're going to form an implementation team including nurse leaders, educators, preceptors, and qualified/safety nurses. We're going to assess current practices by reviewing existing handoff methods, error reports, and new grad nurse feedback. We're going to select tools and framework such as SBAR, iPass. The next thing we're going to do is education and training. We're going to develop training modules by creating educational content on effective communication, structured handoff, and teamwork. We're going to do simulation scenarios by implementing realistic patient simulations for new grad nurses to practice communication with physicians, pharmacists, and other nurses. We're going to do mentorship pairing by assigning each new grad nurse a preceptor or mentor for real-time feedback and support. During our implementation phase, we're going to do a pilot program and begin with one hospital, such as the medical surgical or telemetry unit, and then continue from there. We're going to do structured handoffs, which require all shift changes to use standardized tools, such as SBAR, iPass. We're going to have debrief sessions, which we will conduct post-shift discussions to review handoff quality and communication challenges. In our evaluation phase, we're going to do data collection, and we're going to track things such as communication-related incident reports, patient safety and outcome, new grad nurse turnover, and satisfaction surveys. And we're going to collect feedback from participants to identify barriers and areas for improvement. We're going to do a continuous improvement phase by refining and expanding, so we're going to modify processes based on evaluation results, then expand to all units. We're going to do sustainability, in which we're going to incorporate communication simulations and mentorships permanently into the nurse residency program. And we're going to do ongoing monitoring by reviewing handoff effectiveness and new grad nurse engagement quarterlies. The expected outcomes of this is reducing handoff communication, increasing new grad nurse confidence and satisfaction, improved interdisciplinary teamwork, and patient safety.
The implementation of standardized handoff tools such as the IPASS or SBAR, simulation-based communication training, and mentorship programs is expected to improve communication among new graduate nurses in an inpatient setting, reduce medical errors, enhance patient safety, and increase nurse confidence and retention. This outcome is feasible because these evidence-based strategies have been proven effective in similar inpatient settings. For example, a study conducted at Boston Children's Hospital implemented the IPASS handoff program, which showed a reduce in medical errors by 23% and then preventable adverse events by 30%. A realistic timeline for implementation of this process includes around 1 to 2 months for the planning period, so forming the leadership team and assessing current handoff issues, between 2 to 3 months for education and training, so developing and delivering the simulation and the communication training involved for the personnel, and then 3 to 6 months for the pilot implementation, your trial program with mentorship and debrief sessions, and then lastly, your ongoing evaluation for sustainability, such as collecting data, providing feedback, and refining the overall process. All of these steps resulting in a potential 6 to 9 month rollout period if successful.
With ethical considerations, we need to look at ethical behaviors, equity, and protection. So, with ethical behaviors, it is crucial to obtain informed consent from all the participants before simulations. They should be briefed on the simulation's purpose, their roles during the simulation, any associated risk and benefits, and the option to withdraw at any time without penalties. Confidentiality is important with individual performance data that includes scores and reflections, and the participant should remain anonymous and securely stored. Feedback sessions should emphasize group learning to reduce embarrassment and avoid penalizing specific individuals during the simulation. We want to provide constructive, non-judgmental feedback after the simulation for the new graduate nurses and focus on what went well, what areas that they could improve in, and applying the lessons that are learned to real-life situations. With equity, the simulation should offer equal opportunities for all new graduate nurses to participate, regardless of their backgrounds or shift assignments. That helps us to avoid favoritism toward a specific group. Teaching methods must consider diverse communication styles and learning needs, as participants may have different cultural backgrounds, languages, and levels of clinical experience. Effective strategies including providing pre-briefing materials, allowing time for reflection, and pairing participants in mixed experience teams. To promote culturally competent communication, simulation materials should represent diverse patient populations, including various ages, races, ethnicities, genders, economic backgrounds, and health literacy levels, which will help facilitate effective communication and reducing any biases. With protection, simulations will take place in a controlled, non-clinical environment to eliminate any risk to real patients. The simulations will either be conducted in a designated lab or training space that is separate from direct patient care. Participants' performance data will remain confidential and will only be used for educational improvement. So we are collecting data while ensuring that any patient identifiers that could breach confidentiality are removed. Psychological safety is a top priority as we want new graduate nurses to feel comfortable in their learning environment. We encourage open discussions without fear of judgment or repercussions. And that means that we want the new graduate nurses to feel safe as they are learning, allowing them to ask questions, make mistakes, share any uncertainties, and learn without the fear of embarrassment or penalties. We want new graduate nurses to make mistakes during the simulations in order to prevent them from making the same mistakes in the real world.